So for this hip joint here, we're going to see this very large convexity of the head of the femur going into the acetabulum. So that means our rolls and glides are going to be in the opposite direction, but our glides are going to be very minimized because of how large or how much congruency there is between these two joints, how well they fit together. So superiorly and posteriorly, the glides are going to be very, very minimal, and there will be a slight amount of gliding in the anterior and posterior part of the acetabulum, because that's where the acetabulum is most efficient. So if we start off with flexion here, we would see a anterior roll with a very small posterior glide, and then also because the axis of rotation is piercing both joint partners, we're going to be getting a posterior spin with our reference point being the superior part of the greater trochanter. Also, when we're doing that flexion, the ilium is also going to be moving posterior. And then if we do extension, we will get a posterior roll with an anterior glide that will be slightly more significant than the other glides, and we will be getting a anterior spin, and we will also be getting a anterior rotation of that ilium. So because when people walk, they do flexion and extension of their hips in opposite directions, the ilium are going to be moving in opposite directions. So that is one interesting clinical significant thing with the kinematics of the hip. And now for abduction, we are going to have a lateral roll with a medial glide, and we will also be getting a medial spin as well. And then for a deduction, we are going to get a medial roll with a lateral glide and a lateral spin. Then for internal and external rotation, we are going to be looking kind of down the joint from more of a superior angle. So when we do an internal rotation, we are going to get an anterior roll with a posterior glide that's going to be very small, and we're also going to get an anterior spin. Then for external rotation, we are going to get a posterior roll with an anterior glide that will be slightly more significant and a posterior spin. This motion would actually be the most likely to do a dislocation if I was going to externally rotate and